Our project is on Parkinson's disease by Haley Mason and Meadow Van Doren. What is Parkinson's disease? A nerve disorder thought to be caused by genetic or environmental factors. Most cases of Parkinson's disease are not thought to be inherited unless someone is diagnosed early in life. Most diagnoses are given to people around the age of 60 years old. Environmental factors that are thought to cause Parkinson's include exposure to chemicals. History. First described as a neurological disorder in 1817 by James Parkinson. Parkinson's is thought to have been acknowledged prior to 1817 as symptoms were described in 1768 by savages and in early Indian text around 1000 BC. In the mid-1800s, Jean-Martin Charcot distinguished Parkinson's from other diseases with symptoms of tremors like multiple sclerosis. Symptoms: tremors in hands, arms, leg, head, or jaw, slow movements, muscle stiffness, issues with balance and coordination, difficulty with walking, vocal symptoms, possible slurring of words, soft voice, stuttering, fast or slow speech, etc. Demographics and frequency. Some studies indicate that men are more likely than women to be affected by this condition. The majority of persons with Parkinson's disease are 60 years of age or older. However, 5 to 10% are thought to be diagnosed before the age of 50. Approximately 500,000 Americans have been given a diagnosis of Parkinson's disease, but the actual number is probably much higher given the large number of cases of misdiagnosis and underdiagnosis. According to a study by the 2022 Parkinson's Foundation, almost 90,000 Americans receive a Parkinson's disease diagnosis each year, in comparison to the earlier estimated rate of 60,000 diagnoses annually. This represents a sharp 50% increase. Pattern of inheritance. One parent of an affected person has the condition, so it must get passed down. Parkinson's disease is inherited in an autosomal recessive way if PARK7, PINK1, or PRKN is implicated. The two copies of the gene in each cell are changed as a result of this sort of inheritance. In order to receive the gene of Parkinson's, one of your parents must have the dominant gene for the disease. Causes. A region of the brain called the substantia nigra loses nerve cells. The result of this is Parkinson's disease. Dopamine is a neurotransmitter that is made by nerve cells in this region of the brain. Alpha-synuclein is produced by a protein called SNCA. This protein forms Lewy bodies in the brain tissue of people with Parkinson's disease. The alpha-synuclein gene is situated in the long arm of chromosome 4, and the Parkin gene is located in the long arm of chromosome 6. Both have been identified as the two genes responsible for familial Parkinson's disease. Early onset Parkinson's disease is characterized by SNCA gene mutations. Parkinson's disease causes oxidative damage to DNA and RNA in neurons. A mutation in the UCHL1 gene causes autosomal dominant Parkinson's disease and a decreased catalytic hydrolase activity. As discussed in the previous slide, the brains of people with Parkinson's disease contain abnormal clumps of proteins called Lewy bodies. These clumps of Lewy bodies are largely made of the protein alpha-synuclein. Mutations in the GBA gene are a key risk factor for Parkinson's disease, and there have been major developments for X-linked dystonia Parkinsonism. Diagnosis: there are currently no blood or laboratory tests available to identify Parkinson's disease in non-genetic cases. Doctors typically do a neurological exam and obtain a patient's medical history to determine the condition. A neurologist will be the one to diagnose someone with Parkinson's disease. Parkinsonism is a term for those who exhibit Parkinson's-like symptoms due to other conditions such as multiple system atrophy and dementia with Lewy bodies. Although these conditions may initially be misdiagnosed as Parkinson's, certain medical tests and the outcome of drug therapy may help to determine the true cause. There is currently no way to prevent Parkinson's disease because the cause is overall unknown. Some studies do suggest aerobic exercise can help in prevention, but this is not widely proven. Management and treatment. Despite the fact that there is no cure for Parkinson's disease, some symptoms can frequently be managed with medication, surgery, and other therapy. Medications that are used is levodopa, which is used as a dopamine replacement, carbidopa, which helps with nausea and prevents low blood pressure, which can be a side effect of the previous medication. Dopamine agonists, also used as a dopamine replacement. Enzyme inhibitors, also to increase dopamine. Amantadine helps reduce involuntary movements like tremors. Anticholinergic helps to reduce tremors and muscle stiffness. Another treatment or type of management for Parkinson's disease is deep brain stimulation. This is an alternative treatment to some medications, which is a surgical procedure that implants electrodes into the chest in order to stimulate the areas of the brain which will reduce tremors. Thanks for watching.